If you suffered with gestational diabetes during your pregnancy, you might consider having your child tested. I'm Rochelle Grossman with your latest health news. Gestational diabetes is on the rise, and new research shows that children exposed to gestational diabetes in the womb are more likely to develop diabetes and prediabetes. In some pregnant women, hormones prevent insulin from doing its job helping your body cells absorb blood sugar. Gestational diabetes usually goes away after pregnancy, but researchers say children whose mothers had it have a much higher likelihood of having above normal blood sugar levels themselves. So if you had gestational diabetes, you might consider having your child tested for diabetes.
Women who have pregnancy complications may feel relieved when a healthy delivery is in the past, but if you had high blood pressure during pregnancy, you may want to let your post-pregnancy physician know. I'm Jennifer Dodd, and this is a Daily RX Minute. A recent study found that women who had pregnancy complications related to high blood pressure were more likely to have risk factors related to heart disease and diabetes a few years after giving birth than women who didn't have high blood pressure during pregnancy. Tell your primary care doctor if you had preeclampsia. For Daily RX TV, I'm Jennifer Dodd.
Blood sugar levels that are high but not high enough to be diabetes pose a health risk. Taking steps to reverse the condition may significantly cut the odds of getting heart disease and diabetes. I'm Erin White with your latest health news. With diabetes, cells in the body are not processing blood sugar normally. In time, too much blood sugar in the system can damage blood vessels and nerves. This can heighten the risk of heart disease. Those who have prediabetes have a chance to return blood sugar levels to normal before the condition becomes full-on diabetes. A new study has found that early and aggressive treatment of blood fats, blood pressure, and blood sugar can make a big impact on reducing the long-term likelihood of developing cardiovascular disease. Ask a doctor about lowering blood sugar to reduce the risk of heart disease.
Amyotrophic lateral sclerosis, otherwise known as ALS and sometimes called Lou Gehrig's disease, is a nervous system disease that attacks nerve cells in the brain and spinal cord. These nerve cells transmit messages from the brain and spinal cord to the controllable muscles. No one knows what causes ALS, but it can run in families. At first, this causes mild muscle problems. The earliest symptoms may include twitching, cramping, or stiffness of muscles, muscle weakness affecting an arm or a leg, slurred speech, or difficulty chewing or swallowing. Eventually, strength is lost and it becomes difficult to move. When muscles in the chest fail, breathing becomes impossible. The disease usually strikes between age 40 and 60 years of age. More men than women get it. There is no cure, but medications to control excessive salivation and frequent coughing can help manage the symptoms. Patients with ALS should do breathing exercises and make sure immunizations are up to date. Physical therapy, occupational therapy, and rehabilitation may help to prevent joint immobility and slow muscle weakness and atrophy. Individuals with ALS may eventually consider forms of mechanical ventilation such as respirators.
As the popularity of youth ice hockey has grown in recent years, the injuries associated with it have grown as well. I'm Erin White with your latest health news. The American Academy of Pediatrics wrote that one of the most important ways to reduce injury risk was to expand programs to prevent body checking in the sport. Body checking is deliberately obstructing an opponent by putting one's body in their way. Dr. Michael Ishitani, a pediatric surgeon at the Mayo Clinic Children's Center, says due to the fast, hard-hitting nature of the game, people often ask what kinds of injuries might happen to my children.
The most common type of injuries were fractures, which may require splinting, casting, or even an operation to treat. The next most common type of injury was traumatic brain injuries, or more commonly known as concussions.
Speak with your child's coach about safety rules in their sport.
We may be reluctant to think about the waning days of summer, but it's important to prepare for the flu season as it's just around the corner. I'm Miranda Savioli with your latest health news. In a recent report, the U.S. Centers for Disease Control and Prevention provided recommendations for the flu vaccine, such as getting a flu shot for anyone over 6 months old. Children who are receiving the vaccine for the first time may need 2 doses 1 month apart. The live nasal vaccine is suggested for children as well. However, the report lists several factors and conditions that may rule out the nasal vaccine, such as diabetes, asthma, or taking care of someone with a compromised immune system. Wash your hands regularly and avoid sharing food to reduce your risk of catching the flu.
By translating health information into a consistent, easy-to-understand language, the DailyRx News Network enables you to take control of your health. Sign up for the DailyRx newsletter to receive the latest health news and videos right to your inbox every morning. For trusted, research-based health news, join us at dailyrx.com. Your health starts here.
Many people now live into their 80s and beyond, and part of aging and living well means being able to get around. Orthopedic surgery to help patients who are 80 and older get around hasn't always been considered a safe option, but that may change. I'm Valerie Cabot with your latest health news. More people 80 and older are undergoing orthopedic procedures and recovering well, a new study shows. Although any surgical or medical intervention becomes more risky with advancing age, the morbidity and mortality associated with the described procedures are well worth the risk when weighed against the variable of mobility. The doctor noted, when we lose mobility, our muscles and skills deteriorate, putting us at a greater risk for various mental and physical ailments, as well as simple falls. They suggest walking and doing yoga to add years of vitality to a person's life. Learn the treatment options for an orthopedic condition.
Cerebral palsy is a group of disorders that affect a person's ability to move and to maintain balance and posture. Cerebral palsy is caused by an abnormal brain development or damage to the developing brain that affects a person's ability to control his or her muscles. Cerebral palsy can be caused by genetic abnormalities. Other possible causes include congenital brain malformations, maternal infections or fevers, or fetal injury. The symptoms of cerebral palsy vary from person to person. Those with cerebral palsy may exhibit a wide variety of symptoms, including lack of muscle coordination, stiff or tight muscles, and exaggerated reflexes, or spasticity. Weakness in one or more arm or leg is also another symptom. People with cerebral palsy may have difficulty walking and may have trouble with tasks such as writing or using scissors. Some have other medical conditions, including seizure disorders or mental impairment. The signs of cerebral palsy usually appear in the early months of life, although specific diagnosis may be delayed until age 2 years or later. Risk factors include low birth weight and premature birth, infections during pregnancy and complicated labor or delivery. There is no cure for cerebral palsy, but treatment can improve the lives of those who have it. Medications such as botulinum toxin can be given to help manage spastic movement disorders. Physical, occupational, speech therapy, and recreation therapy can all help patients with cerebral palsy.
Here is some good news for Americans waiting for a kidney transplant. Older adults who donated kidneys were not at an increased risk for heart problems, kidney disease, or dying. I'm Miranda Savioli with your latest health news. A newly published study from the University of Pennsylvania found older kidney donors did not have a different survival rate when compared to non-donors. There was no difference in rates of heart and vessel disease between the two groups, nor was there an increased risk for diabetes, low thyroid function, or osteoarthritis for older donors. However, older kidney donors did have a 53% greater chance of being diagnosed for non-melanoma skin cancer. But the study's authors feel this may be because donors might visit their doctors more often. Speak with your doctor if you are considering a kidney donation.
Tuberculosis, or TB, is a disease that is caused by bacteria called Mycobacterium tuberculosis. Tuberculosis can cause symptoms such as a bad cough that lasts 3 weeks or longer, weight loss, loss of appetite, coughing up blood or mucus, weakness or fatigue, fever, or night sweats. The bacteria usually attacks the lungs, but can also damage other parts of the body. TB spreads through the air when a person with TB of the lungs or throat coughs, sneezes, or talks. A weak immune system increases the risk for TB. Being a healthcare worker can also be a risk factor for TB as well. If not treated properly, TB can be deadly. TB disease can usually be cured by taking several medications for 6 to 9 months. The medications used to treat TB include the following: isoniazid, rifampin, ethambutol, and pyrazinamide. Patients diagnosed with TB should avoid alcohol and should stay home until a doctor says it's safe to return to work or school.